Hi, my name's Kelly Gilson, and I'm the Executive Director at United Way Oxford. I invite you to join us on our new Let's Talk Local Oxford series. We'll share everything about United Way Oxford, our work, our partners, our investments, and how everything we do is designed to create positive social change right here at home in Oxford County. Not only do we want to share, but we hope to inspire you to join in our efforts and learn ways in which you too can show your local love. So, let's talk local, Oxford.
Woodstock Libro Credit Union is the proud sponsor of Let's Talk Local Oxford.
Welcome back to Let's Talk Local, Oxford. I'd like to start by thanking Libro Credit Union for their kind and generous sponsorship of our podcast and their commitment to our community here in Oxford and helping United Way get information out about the work that we do and about the wonderful work of our partners as well. So thank you to our friends at Libro Credit Union. On today's podcast, we will be chatting with Laura McCreery, who is the sexual assault therapist, social worker, and program coordinator at the Oxford County Community Health Center. So, Laura, thank you so much for joining us to talk about this program.
Thank you so much for having me, Kelly. I'm excited to be here, and I'm excited to talk about the program today.
You know, this is a great opportunity, I think, to highlight a program that has evolved and changed a bit over the last year or so. But it's also probably a program that people are not necessarily aware of unless they've personally been directly connected and had need of the program. But it's a really important service to people across our community. So let's start off right off the hop. And Laura, maybe you could tell us a little bit about what the program actually is.
So the program, let's start back about a year ago, because I think having the history of how this evolved would be helpful to kind of bring us to today.
Perfect.
Maybe we start there. So sexual assault services in Oxford County have been around for a while, housed at DASO, Domestic Abuse Services Oxford, here in Oxford County. And for the past 10 years or so, DASO was funded for about 2 days a week to provide specifically sexual assault services. And about almost 7 months ago now, we partnered with the United Way and had a conversation about how sexual assault services really are not meeting the need in Oxford County as it stood with the 2 days a week at DASO. And so we had a conversation about how could we expand this program to meet the growing demand. And we transferred the program in partnership with the United Way and DASO over to the Oxford County Community Health Center. And that took place in April. And ever since April, we've been trying to unfold that program in a way that meets a more diverse need. So currently, the program stands as it did at DASO, which is serving women who are over 16 years of age who reside in Oxford County. And our best hope is to expand that in the future to all ages and all genders to really meet all of the needs for sexual assault survivors in Oxford County.
You know, I think this is a great example of how when we hit a bit of a wall, when we recognize a need in a community and we know we can do better if there's greater opportunities, this is a community that likes to come together, to partner, to collaborate. We knew that there was a need. We knew that there was still a gap from what was already funded. And the ability now to work from DASO through to the Community Health Center really opens up great opportunity to service people in our community who deserve the service, correct?
Yeah, absolutely. Absolutely. And the 2 days a week that were housed over at DASO for many years, let's be clear, was not meeting the need. It just wasn't enough to meet the demand. Our wait lists were growing. And I'd really like to talk about how Oxford County compares to other communities, in that we are historically and currently very under-resourced for sexual assault survivors. And so I like the way you frame that we see a need and we come together to address that. And there's a lot of hope that housing sexual assault services at the community health center will eventually mean an expanded program.
And I think there are many reasons why we are doing this podcast series and why we really work closely with community partners and funded partners. So not just those we fund, but really those on the ground doing great work to try and share information, to share services. We also think it's important to educate the community where there is a funding gap, whereas maybe we've been overlooked as a county historically. And this is an opportunity to help hopefully leverage that to build the case, because as you said, we really are disproportionately funded, aren't we?
Absolutely. So the program has evolved from the 2 days. We're now, thank goodness to United Way, at a 3-day equivalent. But when we compare that to other communities, but the last I looked into it, Brantford, who their population is pretty much equivalent to ours, including the Indigenous population that's in that Brant County. So their population is equivalent to Oxford County. And they have a fully outfitted sexual assault center. They're brilliant people running that organization, so shout out to them for sure. But they have 6 full-time equivalent staff. And that's just the sexual assault center. They also have counseling and services available through Nova Vita, which is the equivalent to DASO in Oxford County. Mm-hmm. So when we compare that, so just the sexual assault center alone, at 6 full-time equivalent staff compared to we're currently at 3 days a week in Oxford County. Mm-hmm. Yeah, to serve the same number of people.
Yeah, that speaks volumes to sort of the inadequacies in funding.
Yeah.
Absolutely. And I think it also helps maybe paint a picture to what the needs really are. Because, we talk about trying to shine a light on unignorable issues, and that unless you can talk about the issue and address it and see it, then we can't move it forward. But these issues, these pressing social issues, these are not just Oxford issues. They're everywhere issues, aren't they?
Absolutely. Yeah. We know that sexual violence has impacted an increasing number of people even through the pandemic. So I think the most recent Stats Canada, it's 1 in 3 women will experience sexual violence in their life. So that's 30%, 33% of the population of women. And that's increased through the pandemic. And this is an everywhere issue, but Oxford County needs an Oxford County service. Right?
Absolutely.
We need to address the populations that are unique to Oxford County. For example, we have large rural populations with some hard to reach people. So my program does go mobile. We have a site in Tillsonburg, Ingersoll, and Oxford. And we really make an effort that transportation or location will never be a barrier to service. We will come to you or we will bring you to us.
Which is so important because in our community, transportation is a barrier to almost everything. And it's hard for some to imagine that. For those that have access to vehicles and insurance and gas and all of the things that you need to run a car. But also the fact that we are home to 2 very large, amazing automotive plants, you would think that somehow transportation wouldn't be the challenge, but it really actually is a challenge here. People often can't get to services because they have no way, and there's very little sort of public transit. And then to try and ask someone to go out of town for service, that just opens up so many other barriers, doesn't it?
Yeah, transportation is a significant barrier when it comes to sexual assault specifically. So we have to imagine what this would be like if you were someone who had survived sexual violence. The way things would proceed from there would be potentially accessing forensics, so evidence collection, specialized health services, et cetera, et cetera. But those are the first steps.
Right.
So currently, as it stands, our regional treatment center that provides those things, so the forensics piece and the initial healthcare pieces. Currently, our regional partner is in London. So what that means for Oxford County residents would be finding a way to get to London, because that transportation is not currently provided. It's not included in any services in Ontario. And specific to sexual assault survivors, that might be very, very difficult. So for example, they may not want to disclose to mom or partner. They may not want to tell somebody and ask someone for a ride. Mm-hmm. So it might look like paying for a taxi. Well, imagine being in the back of a taxi to London after such a traumatic event. Or even worse, sometimes police will transport. Well, that's not a pleasant experience either. As wonderful as our police partners are, it's incredible they provide that support, but they shouldn't be providing that. We shouldn't be transporting people to London after an experience like that. So it's very much a goal of our program at the health center to bring the resources that are available at the regional treatment centers in London, bring those resources to Oxford County. So that is a priority with this program, is we want to be bringing evidence collection, forensics, and follow-up care to Oxford County so that survivors do not have to travel to and from London, because it's just horrific that they have to go through that.
I can only imagine how awful that would be following such a traumatic experience.
Yeah.
Mm-hmm. Absolutely. And it's a nice little segue actually on the transportation piece that recently Laura was kind enough to join us for one of our Women United special events and talk about the program and the need and a little bit more, in a little more depth, I would say, about some of the people that are using the services that have been impacted and those barriers. And as a thank you, we were able to actually present you with some funds from our Women United group specifically for transportation.
Yeah, and that will make such a difference for people who are being impacted by sexual violence. Like, those dollars will make life-altering, a life-altering impact for people that we can provide that service. And we can't express our gratitude enough. However, let's be really clear. This needs to be a service that's in Oxford County, right? We can't keep putting a Band-Aid on that.
That's right. Yeah, this is
right?
a transportation Band-Aid.
Yeah,
absolutely.
Until we can. So that's really giving us that generosity is giving us kind of a bridge to get to the place where we can bring those services to Oxford County.
Now, Laura, you mentioned that currently you're providing services to women 16 and older. And without getting into, obviously, anything that's confidential, could you maybe explain a little bit about who these women are, maybe some experiences because it really could be any woman. Yeah. Correct?
It's absolutely.
And every woman. Yeah. So just maybe speak a little bit about what you're seeing, perhaps.
So it is any woman, any age, from 16 up, any background, working professionals, women living in poverty, mums, aunts, grandmas. It really is anyone. But there are some demographic trends that I do see in my program, and it's consistent with what we know from statistics around sexual violence. We know that the most vulnerable population are women and girls under 25. And I would say that's absolutely consistent with what I've seen specifically through the pandemic. I never would have imagined prior to the pandemic that sexual violence would go up. Like, it just didn't make sense to me. I would have imagined that would go down, right? We were all safe at home.
Because you have and I would say the same for me, you have perhaps an idea that, if you're at home, you must be safe. And if you're not out, at night and walking a dark alley or whatever, in your mind's eye that might look like. But that's not really the case, is it?
Absolutely, it's not. We know with sexual violence that the people who are using violence against women and girls are most often known to the survivor. So it's friends, boyfriends, people who are in a position of power over that individual. So teachers, coaches, that type of thing. It's most often somebody who's known to the person who's experienced sexual violence. Yeah.
Which I think, again, is not what the assumption necessarily may be for sort of what the norm in this very difficult conversation might be. So the pandemic really has highlighted, I think, for a lot of agencies, what vulnerabilities actually existed that perhaps previously flew a little bit under the radar.
Yeah. And I think our youth population has been, well, from our demographic information, we know our youth population, young girls, so under the age of 25, that number went way up in the pandemic. And again, it didn't make sense to me prior to. I never would have guessed that that's what would happen. But I think, just anecdotally, when I try and make sense of what happened over the pandemic, I think the isolation of our young folks has really, that increased their vulnerability. So for example, a young person who was going out to spend time with a new friend that they met online, previously they would be in a circle of friends, which creates some safety. And throughout the pandemic, they were maybe like sneaking out, nobody knew, they were going by themselves. So I think I'm making sense of what happened in the pandemic. A lot of it came back to the isolation of our youth, because we're seeing that in the numbers. It's increasing numbers of young women that I'm seeing.
That is just so sad on every level. Absolutely. But we are proud and so pleased to be able to support your efforts and the expansion of this program through the Oxford County Community Health Center to reach more people, to spread that program across the county in a much more accessible way. Love the fact that you have the ability to go to Woodstock, Ingersoll, Tillsonburg, that you can go to where a woman is at if that's what's necessary. That goes a long way, and I think it speaks volumes to the commitment you have to service the people that are your clients, that you really do care deeply, and that this program is accessible and it's relationship based, and so that's meeting a need. But to your point from the very beginning, it's only meeting some needs. We need to continue to look for opportunities to expand, to grow, and stabilize.
Absolutely.
And I think there's often people will think, oh, well, you could apply for a grant and you could do different things, all of which is true. But stabilized funding is a different thing altogether. It gives you the ability to do the work without constantly trying to write applications and juggle different applications and kind of jury rig budgets and everything else, right?
Yeah. That's always the balance in this program. And I think for a lot of organizations and not-for-profits, to spend the time on that grant proposal literally means not answering the voicemail, right? It's real people that we're not meeting with. It means not scheduling a session for that amount of time. So it's a very careful balance of, it's important that we find stabilized funding, but this program does need to meet the need of the people who are calling, and it is a very busy program.
Mm-hmm. And that missed opportunity is worth a lot, because that missed opportunity is actually someone's life. It's someone's situation. It's someone's crisis. it is someone's kind of here and now, right?
Absolutely, yeah. And the people we serve come first, always, and they always will.
As well they should, yes. So Laura, as we wrap up this session and your talking about your program at the Oxford County Community Health Center on sexual assault, do you have any sort of parting words that you would like to leave with people listening, with community members, that to just help them again understand or maybe retain some information that they might pull out of their hat down the road for themselves, a friend, a co-worker, a neighbor, whoever it might be?
Well, you can find me. I'm easy to find, Oxford Sexual Assault Services at the Community Health Center. So at any time, the service is completely confidential. If you want to give me a call and ask questions about programming for yourself or a loved one, feel free. My door is always open, even as a resource to find another service if my service isn't the right one. But my parting words for Oxford County would be, the challenge is all of ours to address, in that this is a real problem for people in Oxford County. Sexual violence is only going up, it's not going away. So we need to come together and address this for our neighbors, our friends, our families. So the challenge is all of ours. This work is on everyone's shoulder, but also I want to leave with a sense of hope that this program shift over to the health center really is opening doors that haven't been open for a really long time. And we are incredibly optimistic about what services will look like in the future in partnership with DASO and the United Way.
That is a wonderful sort of note to finish up on. So thank you for that, because we really do believe in hope and opportunity, and United Way's ability, as well as our other partners, to find the pieces to build that hope and opportunity. And your comments really speak volumes to what we say here all the time, is it takes a village. That we are all part of the village, and none of us can do this work. No organization can do these important services on their own. It takes everyone coming together to play a role, whatever that role might be. So, Laura, thank you so much for joining us today, and thank you for all of the work that you do in our community. You are kind and compassionate and warm, and I can't imagine someone who is better suited to help a woman during a crisis like that. So I have nothing but admiration for you, and I know that you're changing people's lives and helping them through the most difficult times that they face. So thank you for that, and it's our pleasure to be able to help you do a little of that as well. And I would like to invite people to stay tuned for some upcoming episodes where we continue to highlight some of our funded partners and partner agencies and their good work making a difference in people's lives each and every day here in Oxford County. You know, we estimate that 1 in 5 Oxford County residents are using these United Way funded programs and services because they change lives, because they really create hope and opportunity. So thank you for listening, and please join us for future episodes to learn a little more about the needs in our community, and also how organizations at United Way are working together to meet those needs. If you have any questions about this podcast or any of our other Let's Talk Local Oxford podcasts, please reach out to Mike at unitedwayoxford.ca. He will gladly take feedback and share, and suggestions are always welcome. Once again, I would like to thank Libro Credit Union for their support. And finally, thank you for joining us, and we'll see you next time on Let's Talk Local Oxford. Take care. Thank you for listening to Let's Talk Local Oxford. If you would like to learn more about United Way Oxford, our work, our engagement, our volunteer opportunities, our partners, or to even make a donation, please visit unitedwayoxford.ca or call our office. We love to chat, and we really love visitors too. If, however, you find yourself needing a hand to locate a program or a service, please call 211. our information and referral service. They're there to connect you to local supports 24 hours a day, 7 days a week, 365 days a year. Remember, 211, they are there to help. Until next time, join with us by showing your local love. We all could use a little more of that. Thank you.
Thank you for tuning in to Let's Talk Local Oxford, proudly sponsored by Woodstock Libro Credit Union.